There's much to celebrate in terms of reducing teen pregnancy and birth rates in all states and among all ethnic and racial groups. The Wall Street Journal recently called the reduction in teen pregnancy a rare public health victory. Birth rate is at an all-time low at 40.4 per 1,000. Overall, the teen birth rate decreased 35% between 1991 and 2005. The U.S. still has the highest rate of teen pregnancy in the industrialized world. 1 in 3 teen girls becomes pregnant at least once before age 20, meaning 750,000 pregnancies per year. There are 3 million cases of STDs annually reported among teens. Teen pregnancies link to poverty and other social issues. What are the chances of a child growing up in poverty if his or her mother 1. gave birth as a teen, 2. was unmarried when the child was born, and 3. did not receive a high school diploma or GED? Well, if one of those 3 is true, the child has a 27% chance of growing up in poverty. If 2 of those are true, the child has a 42% chance of growing up in poverty. And there's a 64% chance if all 3 things happen. If none of these 3 things happen, a child's chance of growing up in poverty is 7%. A child born to a teen mother who has not finished high school and is not married is 9 times more likely to be poor than a child born to an adult who has finished high school and is married. What are the consequences of teen pregnancy? Only 40% of young teen mothers graduate from high school. Teen fathers earn less than older fathers. And compared to children born to older mothers, 20 to 21 years or older, children born to teen mothers are more likely to drop out of high school, use Medicaid and S-chip, experience abuse and neglect, enter the foster care system, and, in case of sons, end up in prison. Costs of teen childbearing. Costs to moms. Well, we've got public assistance that includes TANF, food stamps, housing. We have lost revenue, and that's the decreased earning and spendings due to lower educational attainment. The overwhelming majority of costs are those to the children of teen mothers. These children as adults have decreased earnings and spending due to lower educational attainment. So this is saying kids of teen mothers don't get as much education. Public health care. They're more likely to use Medicaid and S-CHIP. The public health care also includes CHAMPUS and a small share of Medicare for disabled children. Incarceration. Although the number of young women in juvenile justice and prisons are growing, the numbers were still too small to determine whether having a teen mother is a risk factor for her, but it is for the sons. Child welfare. Well, the cost in this case is mostly foster care costs. Teen fathers. Lost revenue, again, due to decreased earnings and spending. National findings. Teen childbearing costs taxpayers at least $9.1 billion annually. The total cost breakdown is $8.6 billion for those 17 and younger, and $0.5 billion for 18 to 19 years old. The average annual public sector cost associated with a child born to a mother aged 17 and younger is $4,080. Most of the cost of teen childbearing is associated with the negative consequences for the children of teen mothers. So it's the children of the teen mothers, that's where the money is being spent. It's being spent for healthcare costs, for welfare costs, for the prison systems, and for lost tax revenue because these people are getting lower paying jobs. Between 1991 and 2004, there have been more than 6.7 million teen births in the United States. This cost taxpayers a total of $161 billion between 1991 and 2004. The one-third decline in the teen birth rate between 1991 and 2004 yielded substantial cost savings. Taxpayers saved $6.7 billion in 2004 alone. There were approximately 6.8 million teen births in the United States between 1991 and 2004. Again, this cost the nation $161 billion. Children of teen mothers are more likely to have decreased educational attainment, earn less money, suffer high rates of abuse and neglect, grow up poor, live in single-parent households, enter the child welfare system, and become teen mothers themselves.